My name is Dr. Norma Edwards. I'm a general surgeon here at Premier Surgical Associates. I do a variety of surgeries, everything from biliary disease, so gallbladders. We also do most anything in the GI tract, colon cancer surgery, stomach surgery, small bowel surgery. We do hernias, abdominal wall issues, ventral hernias, umbilical hernias, inguinal hernias, lumps and bumps. I love to do intestinal surgery, abdominal wall reconstruction, abdominal wall hernias, and gallbladders. Those are my favorites. I like taking out gallbladders so much because patients come in with distinct problems. You take them for an operation, which can be simple, can be complex, and it just depends on, sort of the history of the disease. But when they come back to the office, you can really tell the difference, how much they feel better, and it's really rewarding to take a patient from having a significant problem to feeling so much better. I always say that when you go to medical school, your specialty really picks you more than you pick the specialty. I think everybody ends up where they're supposed to be based on their personality. And for me personally, when I was in medical school, it was my first rotation, and nothing was ever as exciting or as much fun. And I really always liked seeing the results. Patients come in with a specific problem, you do an operation for them, and they have a specific result. And you can really see the results of your work. I went to college at the University of Tennessee, Knoxville. I went to medical school at the University of Tennessee, Memphis, and I stayed there for my residency. I'm originally from Memphis, but my family is all from up here. So when I was done, I was in practice in Memphis for 8 years, but ultimately I wanted to come back to where my family is. So that's how I ended up in Knoxville at Premier Surgical Associates. When patients come in, they're often very scared. They're in the surgeon's office. They're facing a surgery, an operation. It's a very scary prospect. So I always think of it as my job is to educate them on what their doctor who has sent them thinks that they have. We look at their films or their ultrasounds or what have you together. We talk about their risks and benefits. What are the benefits if we do surgery? What can happen if we don't do surgery? And I really think that it's always a team approach. So with the patient, with their family, I want us to be able to make this decision together. And so I think of my job as I'm there to educate them, to help them make the right decision for them. Sometimes the right thing is to not have an operation. It's our job to look at everything all together and what are their risks. And if their risks really outweigh their benefits, sometimes the best thing is to not have surgery, but they always have a connection. So if something changes or they have a problem, they always have somebody that they can go to. My favorite thing to do is triathlon. I do half Ironmans primarily, so I love swimming, biking, running, 70.3 miles. It's a good challenge. It keeps me in shape. It keeps me active. I have to train a lot, and that's a good stress reliever, and it's a good way just to be healthy. And that's my favorite thing to do when I'm not here.